think there are multiple benefits for patients having awake shoulder and elbow surgery. The obvious key benefit is avoiding the risks of a general anaesthetic. And although the risks of a general anaesthetic might be rare, some risks such as nausea and vomiting after surgery are quite common and well known amongst patients and cause a concern for patients. With awake shoulder and elbow surgery, there's no nausea and vomiting after surgery. Patients can often eat straight away. From a surgical point of view, I quite enjoy, if the patient's having a keyhole operation, being able to explain them what we find during their operation and giving them a better understanding of what is done inside their shoulder. This helps them after surgery to be confident with their rehabilitation, and means that our consultations after surgery tend to be focusing on rehab and how to get better and get back to a normal level of activity, rather than still having to focus on what was found or what was done during surgery several weeks ago. Also, patients leave hospital quicker because they don't have to recover from the drowsy effects of a general anaesthetic, and they can also get back to activity quicker. And I think that all these benefits are why I tend to offer this to my patients as an option for their surgery. Ronnie, what do you think?
Yeah, I absolutely agree with that. I think for me, there's a few key points. What Nick said about patient being able to get on with it with their own life. We all have very busy life, and a general anesthetic can cause a phenomenon called fatigue, where you can be exhausted for days, sometimes weeks, not really understanding why. And even if everything was done, by the book, you can still have that tiredness, which you obviously don't get with awake surgery because only your arm is numb, and so I won't be doing anything to your brain or your heart or your lungs. So it's really safe. The other thing that I'm really keen on is a really good pain control. So obviously the pain for the operation and after the operation, but also there's another phenomenon called chronic pain, which means that having really strong, heavy pain that can last a few days, sometimes a few weeks or more. And the best way to prevent that is regional anesthesia, so that injection of painkiller before the operation. And as Nick Ferran said, avoiding the risk of general anesthetic is great. So that means that we can offer this operation that will improve patients' quality of life. Now, all of a sudden you'll be able to reach these things in the top cupboard. And even if your health is not 100%, because we can offer this technique where you're awake, then it's still really safe, and you can still, get on with your life and do whatever you want to do, really.
I agree. I think awake shoulder surgery under regional anesthesia allows us to offer surgery sometimes to patients who aren't fit enough for a general anesthetic. And sometimes this is their only option to be able to get that improvement in quality of life from surgery without avoiding the severe risks that a general anesthetic might pose because of the conditions that they already have.